in her case, we got to see the actual electromagnetic conduction test, which was great.
Okay.
Throw a little Farsi in here, right? I don't know enough, right? Yeah, Kami, Farsi balada. Yeah, I know. It's just, I know. Just a little. Okay, deep breath in. Deep breath in again, all the way out. Good. Not too bad. Move it up here. Good. Okay, let's lay on your back, head right here. I'm gonna toss the face paper too, okay? See if anybody knows this reference. It's a goose. Jim Carrey, Liar, Liar. Yeah, it's in the bloopers. The movie's amazing. In the bloopers, he just like... Bush. Good, easy. Woo! That was a lot. Yeah, you needed that. They're not always that aggressive. Let me see your hands. And then we're gonna work on your hips today, okay? Okay. Lay on your side facing this way. You got one more, okay? Perfect. Perfect.
Thank you.
You're welcome. That moved a lot too. It's good.
Thank you.
You're welcome. I'll see you soon, okay? Thank you. So she came in with, she had a lot of numbness in her hands, and there's a test that they do where they hook you up to electrodes and see like your actual sensation and changes. And we got her post records where under care, her the nerve conduction improved. So it's seeing nerve conduction. Not only do we have people who get better with numbness and tingling in their hands and their carpal tunnel, stuff like that, but in her case, we got to see the actual electromagnetic conduction test, which was great. So she's been doing great. We've been taking care of her for like 2 or 3 years. She's just wellness, comes in every other week or so. Keep her put together, so it's been good.